Hello and welcome to the Church World Service webinar series, Caring in Crisis, the Leader Briefs. I'm Reverend Mary Hughes with Crisis Care Ministries, and we're so glad that you've joined us today. You know, we have been working on this series for several weeks, and today we are concluding our series. We're so glad to welcome Miriam Gelo in just a moment. I'll introduce her in just a moment, but first, a few housekeeping reminders. As the introductory slide rotation indicates, you can find all things webinar, details about our schedule and the presenters and the resources our presenters have provided at crisiscareministries.net. Just click on the webinar hub at the top of the page. It is updated regularly, so we remind you that you may need to refresh your page. After the webinar, watch your inboxes for links to the webinar recordings and a link to the session evaluation. If you have requested an attendance certificate when you registered, you'll be receiving that by email as well. And if you have any questions about your attendance certificates, please contact Heather Wilson. And you saw her email address on the slide rotation, HWILLSON, Heather Wilson. HWILLSON at cwsglobal.org. I also do want to offer a word of thanks to Church World Service for inviting me to help with this series on behalf of Crisis Care Ministries. A special thank you to Rebecca Belays, Matthew Stevens, and Heather Wilson for all of the wonderful help that they have provided. And now it is my great honor to introduce to you Miriam Gelo. Ms. Miriam Gelo has worked with the Federal Emergency Management Agency, FEMA, since 2001, where she began her career in emergency management as a volunteer during the September 11th, 2001 World Trade Center response in New York. And she was hired by FEMA during that event. She has since responded to over 50 events delivering the individual assistance programs and has served most of her career as a voluntary agency liaison, our wonderful VALs, as we call them, in partnership with the voluntary organizations active in disaster in events really all over the country. It is my deep honor to present to you my friend, Miss Miriam Gelo.
Thank you so much, Mary. And thank you to you and to Church World Service for giving me the opportunity to share information with this vast audience of community faith leaders on what emergency managers would like the faith and community-based organizations to know. This is, as you're aware, this is a very important topic as we partner very often with the local organizations. As a FEMA voluntary agency liaison, we work with many faith-based organizations as we recognize the amazing work that's done by many non-governmental organizations, whether serving in large disasters or be it a small church serving meals year-round. You are seen and appreciated, and we acknowledge that what you do is not necessarily for recognition or accolades, but to humbly help and serve and see to the needs of your immediate communities. Emergency managers recognize the vital services that you provide on a daily basis. And without that very local network of powerhouses, you all, in a disaster event, immediate response would not be as timely. I would imagine it would not be as timely as it needs to be to get help to the local people. There are a couple of key points that are important for emergency managers to convey to leaders in the faith community. Emergency management can be a very big area to try to understand in the short time here that we have here together. But recognizing that there are different levels in emergency management is a first step to demystifying some of that complexity. So I'm going to share a presentation. Let's see if I do this right. Can you see the presentation, Mary? Okay. Great, thank you. Okay, so some of the levels of emergency management, and this may be basic, but we've got a couple of different levels. So there's that local emergency management. There's the state, tribal, territorial, or STT. You may see that acronym, or you may see SLTT, state, local, tribal, territorial. But for this, there's local emergency management, there's state, tribal, territorial emergency management. And then there's us, the federal emergency management. So at that local level, that is where you all live, right? The local faith-based organizations, community-based organizations. So it's really important for you to know and to establish a relationship with your local emergency manager, local first responders. You all provide critical services year-round, or essential services. You're serving your community. What does that look like in a response event? So local emergency management has their locally developed emergency response plans. If you provide a service, or in the past, depending on different disaster events that may or may not have, that may have affected your areas, what has been your role? Have you seen your roles augmented in these types of events, whether it's a natural disaster, a man-made disaster? And if it's something that you see yourself doing again, or something that you want to engage in, connect with that local emergency manager. They have local plans that are shared with the first responders, so everybody knows what players are playing in the event, and be considered. So you want to establish that relationship and make yourself known. Sometimes you don't know if you're going to be part of a response event. More than likely, it's what we call an ad hoc or spontaneous, because your congregations, your houses of worship, your members, house of worship members, they know you, they trust you, they are going to go to you to evacuate, to shelter, for needs, for services. So you may or may not be prepared, but if something happens, they probably will be coming to you. So you want to be prepared, and you want to be acknowledged, and get the resources that local emergency management may be providing to those assisting in a response, in in disaster response. The next level is a state, tribal, territorial emergency management. So they provide resources to the affected areas, and they're the ones that request federal assistance. So if the state's capacity has been exhausted with their commodities, that is when they turn to the federal government and request that assistance. And I'll get to FEMA in just a second. Oop, I did not want to do that. There we go. So the state also has statewide plans. They've got, some of them are in the process of revamping or dusting off their plans off their shelves, as we have entered hurricane season now. Some of them are rewriting their plans. Some of them practice and test their plans throughout the year, which is really the purpose of a plan, right? You want to exercise and test that plan, and have all the players engaged that are going to do a response. So they develop mass care plans, and by mass care, it's reunification, it is sheltering, it is feeding, that mass feeding, evacuation. What do evacuations look like? Pet sheltering. So there's different things that are within those state plans. Donations management plan, or possibly a volunteer management plan. So what does that look like, and what is the state's role? And so as I'm talking about these things, do you all see yourselves as having done that, or wanting to get engaged in doing that? Again, get engaged with your emergency manager, establish and build those relationships with them, and the first responders. The next two bullets I actually have as just for your awareness that these positions exist, right? Some, if not all, of the states have a a position, a state voluntary agency liaison. So that's actually what my role is at the federal level. I'm a FEMA voluntary agency liaison, but the states do have their state voluntary agency liaison, and they're the ones that network year round with the nonprofit community, from, well, some of those larger voluntary organizations, the Salvation Army, Catholic Charities, American Red Cross, United Way 211. So they will liaise and be that point of contact at the state level with these organizations, but also at that state level, they talk and they communicate, and they want awareness of what some of what we call the grassroots organizations, or what some of the faith-based and community-based organizations are and what they're doing. What is the capacity? How can we engage? The purpose for emergency management, if you're the, management, is really to coordinate those services, to avoid stepping on each other, to avoid duplication of benefits and services. So what is, how do you plug into those systems? Right, and those are the questions that you should be asking yourselves, again, if you want to engage. The other network that exists out there are the state voluntary, state VOAD, or state voluntary organizations active in disaster. So if you hear VOAD, that's what that is, voluntary organization active in disaster. And each state or territory has a VOAD. And again, as we go to the next tier, the federal level or the national level, there is a national VOAD, which I'll touch on in a bit. But that state voluntary organizations active in disaster, when a disaster hits, or if there is an impact coming, a hurricane, something with a notice, right? So you see something coming, they start engaging in possibly daily calls, or they'll go to every other day calls as response goes on, or impact, to coordinate all the services and find out who's on the ground and find out who's coming. So if you want to be part of those calls, you can go onto the state VOAD websites, and you can find those on the national VOAD website, which at the very end, there's a resource and it's got the national VOAD link. But if you want to engage with your state VOAD, just to, again, introduce yourself to your emergency manager, introduce yourself to your local and state, to your state VAL, to your state VOAD chairperson. Just say, hey, hi, we're here, we exist, recognize us, right? So those are some resources and that role for the state, at the state, tribal territorial level. The next level is federal emergency management, which is us, right? So FEMA would come in, right? We would support the state, local, tribal territorial governments when requested by the state and approved by the President of the United States, right? So the president has to federally declare a disaster for FEMA to come in. Which is a misunderstanding that people have. Something happens, and if it's not a Cat 4, Cat 5 hurricane or a devastating earthquake, if it's something that's possibly marginal and FEMA's not on the scene immediately, or the state hasn't requested our support yet, a lot of the local people say, where's FEMA? Where's FEMA? Well, we need a federal declaration in order to come in and help provide resources to the states. Fast forward, there's a declaration. So here comes FEMA with commodities, assets, the FEMA programs. So we've got a couple of programs that, mitigation, we have individual assistance programs that are the programs that when people register for FEMA assistance, the individuals and households, those are the programs that they're applying for. There's public assistance, which takes care of roads, bridges, infrastructure. So there's a couple of programs that are activated. Sometimes there is only, there's a possibility of a public assistance only declared disaster. So you may see FEMA, but that does not mean that individual assistance is declared. So people can't call the 800 number and register for FEMA assistance because individual assistance is not activated or declared for that. So just know the different types of declaration. There could be a small business administration only declaration, which FEMA is not a part of. We partner with the SBA, but they are not part of FEMA. They're their own federal agency. So there's also agricultural. USDA may have their own declarations if there's a big agriculturally impacted event. So just know the different types of disasters, the different types of declarations, the different lead federal agencies for that, and know when FEMA's there or not. But again, your resources are that local and that state emergency manager. And again, FEMA, we have FEMA VALs as well, which is what I am, a FEMA Voluntary Agency Liaison. I've been with FEMA for 21 years, and about 17 of those years has been as a VAL. Love it. I think it's the best job in government, but don't tell anybody. So we partner with our regional VALs. There's a VAL in every region, and at the very end of the presentation, which I believe Mary will upload the presentation so that you can have it and you can see the VAL map at the federal level, what the FEMA regions look like, where you fall in. There is a FEMA voluntary agency liaison, just like there is one for the state, one for each state. There's a FEMA VAL for each one of the 10 FEMA regions and the 2 area field offices, which is out in Hawaii and Puerto Rico, the U.S. territories, or well, Hawaii is a state, but for Guam, American Samoa, those territories. So know who your VAL is. Again, if you have any questions on federal resources or questions, your VAL would be your point of contact for that. So there are email addresses on that map that, feel free to reach out as well. And then National VOAD. National VOAD is a very small office, but all of the state VOADs and about 75 plus organizations are members of National VOAD. There are some criteria to be members of National VOAD, but just know that they are out there. They've got those big organizations, Team Rubicon, Tzu Buddhist Foundation, Islamic Circle of North America, the Salvation Army, Southern Baptist Convention, just a whole bunch of organizations that work at that national level. They may have local affiliates, right, that will be part of the state VOADs. So it's a big connection, right? There's a ladder of progression, but know that everybody is there to help. And just know that these are resources for you should you have any questions, or if your local church or house of worship has some needs, you can reach out to organizations or listen to those state VOAD calls and just listen to what's going out there, to not duplicate those benefits and services. So with that, again, engaging in response and recovery, I spoke a little bit about in the emergency management slide before, what some of those levels do, right? So you've got the state that has the state plans, but where does sheltering occur? At the state? Maybe, but it's really at that local level, right? So, but if something is coming, there may be shelters in other areas. But if you are called upon, or if you see yourself acting and serving as a shelter, because if a disaster happens, people will come to where they know, people that they trust. What are some things that you need to consider? I just have a couple of things here, but it's much broader and bigger than that. So persons with disabilities, so those persons with access and functional needs. Is your house of worship, set up to accept persons with access and functional needs if you're serving as an ad hoc or spontaneous shelter? Pets. Some people won't evacuate if they can't leave home with their pets. I've got my cat. I'm not going to leave home without my cat. Love my Tango to death. But they're members of the family. And so we want people to be safe. That was a huge thing after Hurricane Katrina in Louisiana, where people would not evacuate, because of their pets and for other reasons. But because of some of those findings after why they wouldn't evacuate. The PCAMRA, the Post-Katrina Emergency Management Reform Act, was put in place, and now FEMA and our mass care side of the house, they consider, and they do pet planning. State should have a pet evacuation or a pet sheltering plan as well. So again, things to consider. Should people be going to your location? Are you equipped? Are you willing to receive people, with animals? And then there's COVID. We're still in COVID timeframe. So do people feel comfortable going to a congregate shelter? Do they want to house? Do you have masks handy to hand out to people if they don't feel comfortable? So just some of those considerations when it comes to sheltering. The other thing with sheltering is that if you do want to become a shelter, contact the American Red Cross. They're our lead, not our lead, but that's their area of expertise, one of their areas of expertise, right? They do the sheltering, they manage shelters. But if you want to manage your own shelter, the Red Cross can come in and train your staff on how to manage that shelter, how to do accountability, how to do head counts, where to report to. If you need commodities, that's another thing that the American Red Cross can help with, but you have to coordinate with them first and see what they are willing and able to do at that local level. So if you have any questions on sheltering or becoming one or getting support, again, contact your emergency management agency and state if you want to be recognized as a shelter so that they can count on your facility to do that. And then contact the Red Cross for that training if you need it. Again, feeding, if you just want to do feeding, and the cultural considerations I just put in there because people may go to your house of worship, but people may be caught in a place where they can't go to their house of worship and they'll go to the nearest safe space. Cultural considerations are people with food restrictions or food limitations. So what does that feeding look like and where can you get the support for that? And also you don't want to duplicate what others are doing. Getting involved in those VOAD calls would be important to find out who's feeding where and who's doing what to avoid that duplication. You may be feeding at your church, but there may be a Salvation Army canteen right around the corner feeding as well. So we want to make sure that that in this coordination process, everybody is getting served and that everybody's not in this one hardest hit area, but you also have rural spaces that are not getting the services and the deliveries that they need, right? And not everybody's going to go shelter. People are going to shelter in place. They're not going to want to leave their homes. So, what does that look like at that local level? Donations management, Mary, it could be the disaster within the disaster, right? If a disaster happens and it's catastrophic enough, the whole country is going to want to empty out their garages and their attics and their basements and fill a garbage bag filled with stuff that they don't need or want anymore and send it forth to some unknown location. And it will probably wind up on your street corner because they're not going to turn around and go home and then after they get guidance about donating responsibly, which is coordinating, right? You call a place ahead of time. What are the needs? So there's a whole messaging campaign that we do when it comes to donations, but it doesn't really reach everybody and people just want to give, and we understand that. But it does become a very time-consuming project to have to sort all those donations, sort out what is usable versus what is not usable. Those items may not be gently used. They again, people just want to give and they think these poor people have lost everything, they will take this. No, that's not the case. So again, what is your involvement with donations management? Do you want to serve as a collection point? Again, that coordination with emergency management will be critical. Do you have warehouse space that you are willing to offer? Because this will happen. doesn't matter what amount of messaging we provide, or the state provides, or the local provides, people are going to want to give. So if you have warehouse space that you want to offer up and say, this is going to happen, we know this, we can set aside, you can serve as one of those collection points. And then, with volunteer management, I put volunteer the reception center on there, and I kind of jumped to that real quick because as we're talking about sorting, if you don't have sufficient volunteers in your place and there is a volunteer reception center, perhaps you can state the needs to that VRC, volunteer reception center, and have volunteers brought over to help you sort those donations. So again, it's all these functions are interlinked to a certain extent. But the state, we've gone away from those physical VRCs or volunteer receptions more and more in the past disasters as these online tools have become available. People register for volunteer reception centers, but again, that's the state may or may not have a portal or a designated spot for donations or for volunteers to sign up. So again, find out what the state has and how you can tap into those resources should you need that. And it's not just about being that collection point, but if you need donations and a warehouse is somewhere else, how do you access that, right? So that's that spontaneous, unsolicited donations I'm talking about. So those are some quick response things and how possibly you can get engaged or connection points if you've done some of the services already. Recovery. So recovery, response happens as response is happening and there's a declared disaster or not a declared disaster. The community, right? You all are engaged in developing long-term recovery groups. There's a point in time where state programs end, where federal programs end. So what are those disaster-related unmet needs for those survivors? Where is case management? Where's that coordination point? Where is that happening? So these locally formed long-term recovery groups will carry on, and that is comprised of you all. So it's local organizations, community organizations, the nonprofits, right? That's a nonprofit-led coalition. It is not government-led. State is invited, local is government may be invited. FEMA VALs usually go because we do provide services and information on disasters to that, but we do not run those meetings. But we may help support the local communities in that, and National VOAD absolutely has a pace and a place and a space in the development of the long-term recovery groups. So you can definitely engage in that, be part of that, be part of what is called the unmet needs roundtables. So that next bullet is providing resources. So when case management is done and a disaster survivor, an applicant still has disaster-related unmet needs, where are the resources that can help fill these needs? So case management has done all their due diligence. The person still has, or that household still has needs. If you've got resources to share, you can be part of that unmet needs roundtable and provide resources to help fill that need. You don't necessarily have to do the case management or anything else on the long-term recovery group. But if you've got resources and you want to share and help meet the community needs, that's a place for you to do that. So again, keep your eyes and ears open for these local coalitions, where they're developing and how you can be a part of that. So I spoke about programs before at the very beginning about individual assistance and public assistance after a declared disaster. This is just a graphic that shows what the difference between individual assistance and public assistance, those grant programs are. Okay. So this is a document that is one of the resources that you can download and just keep and have and hold and love and cherish forever. But again, individual assistance is for those individuals and households, and public assistance is for the roads, bridges, infrastructures, historic buildings, water systems, and so on, and public utilities. Okay. What I do want to mention with individual assistance, and I didn't talk about the sequence of delivery here, but I'm just going to go back one slide, the long-term recovery group, or for recovery, one of the things that FEMA VALs do go out and talk about, one of the information that we share is about the sequence of delivery, and that is for individual assistance programs. And basically it's a graphic or the flow of assistance that demonstrates how disasters begin and end locally. And that is you all, the community and faith-based organizations, local first responders. You are there before we ever get there, before the state gets there, you are there. So, and then there's FEMA programs in between. And as I mentioned, the Small Business Administration, they're their own federal agency, but they are part of that sequence. So FEMA has the grant programs, SBA has disaster loans, and even it's a misnomer. Well, it's not a misnomer, but people get confused with the Small Business Administration, thinking if they register for FEMA assistance and they get a disaster loan application, they throw the application out because they think I'm not a business, therefore it goes in the garbage, or I don't want a loan, I just want the free money, therefore the loan application goes in the business. The SBA loan application process, should the survivor receive that loan application, it's important for them to fill it out, because that will stop them. If they don't fill it out, they will not go on to the other level of grant assistance, which they may or may not be eligible for, but they won't know if they don't do their due diligence and fill out the necessary paperwork. So there is a flow to that. And again, come disaster time, VALs can go more into depth and educate you all, but we like you all to be that force multiplier in messaging. Should there be a disaster and people register and they come to you and they say, FEMA denied me assistance, and you're like, well, FEMA, you know, there are certain reasons for that. So we definitely want to get you all educated and help us spread that message to get the most benefits for the survivors as they can, that they're eligible for. So fast forwarding again. Oh, that's backtracking. Okay, that's part of the individual assistance. Okay, what houses of worship need to know about the FEMA disaster aid process? So are you prepared? Again, can't emphasize enough, connect with your local emergency manager and first responders for information. So part of that whole preparation process is getting that information. So what do emergency managers and first responders, like what do they have to share with you? Well, they can let you know if you are in a high risk area for a disaster prone area. Are you in a flood zone? You know, they've got zoning maps that they can let you know where you fall, depending on where you fall with some of those risks. You know, the National Flood Insurance Program, that's something that you definitely want to take a look into. I've got a couple of notes here. I just want to make sure I'm sharing everything that I need to share with you. Okay, so the National Flood Insurance Program. Yep. So if you don't have, if you're in a flood risk area and you're not part of the NFIP, you can go to the FEMA website, put in NFIP. So it's FEMA.gov, FEMA.gov, and look up flood insurance program and get some information on that. But that's something that you definitely want to take a look at and be prepared, and document your inventory, right? So should you put in a claim or with the flood insurance, document your inventory, right? Okay, so Small Business Administration. The first step is applying apply for low interest loans. So there's critical services that you may provide, and then there's non-critical services, right? So your day-to-day operation, and there's a reason for knowing what it is that you provide. So if you are registered or recognized as one of those shelters or a feeding operation, you're providing critical services. In order to get any kind of federal, should we get to that point, any kind of federal assistance or federal aid, know that the assistance that is offered at that local level from your house of worship has to be open to everybody, right? Because FEMA needs to make sure if federal funds are at all engaged or being dispersed, the the facilities need to be equitable in their services and not turn anybody out. It can't just be for congregation members. It has to be open for everybody. So if you're recognized as one of these critical services or essential services, and you're opening your doors, make sure that they're open to everybody, because come time for application or any kind of, and I'm talking about public assistance now, even though this is like under the SBA administration, that doesn't apply for SBA, but it does apply for the FEMA public assistance grant. So SBA is a loan application, and houses of worship are considered private nonprofit organizations that provide non-critical essential social service. This category of nonprofits must go through the loan application process with the Small Business Administration Disaster Assistance Program before FEMA can determine eligibility for our public assistance program, which reimburses expenses for emergency protective measures, debris removal, and repair or rebuilding of disaster damaged property. So yes, I'm reading these notes because I want to make sure that I share with you what you need to know. SBA's low interest disaster loan provides up to $2 million for damaged real estate and the repair or replacement of property such as furniture, fixtures, and other eligible inventory. So while a house of worship, you don't necessarily need to take out a loan, but note, public assistance will not fund any associated permanent work unless an SBA loan application has been denied or does not have coverage, or does not fully cover the permanent work costs. Again, we don't want to duplicate benefits, and you have to exhaust all avenues in order to apply for grant monies. So if you're denied that loan application, you can apply for the grant program, the public assistance. Religious organizations that provide a critical service do not have to go through the SBA process. So that's the difference, right? So if you're not providing critical services, you have to go through the SBA loan process. If you are providing those critical essential services, you don't have to apply for the SBA loan application. Nonprofit organizations that run medical and educational facilities are considered critical services. This category of nonprofit can work with FEMA on potential grant without applying to SBA first. However, this only applies to facilities providing critical services. Houses of worship must still apply for an SBA loan for damaged facilities providing non-critical services. So if you have any additional questions on that process or anything that was stated, again, contact your emergency manager, or your state VAL or local VAL, and they can explain a little bit further. Also, if you have insurance, really the first, well, you're applying for the loan application, but at the same time, you're submitting your insurance claim, right? Government is not going to duplicate any kind of benefit. So if you have insurance, recognizing that not everybody has insurance or the right type of insurance, but even if you don't have flood insurance, and it was a flood event, so you know that the insurance isn't going to cover it. Still, if you have insurance, you have to apply for a claim. And once you get that declaration letter, or the insurance response on what the claim status is. If they denied you, it's not an eligible claim, then you can, apply for other grant assistance, right? But you definitely want to go through your resources first, right? Again, note that government is not going to duplicate benefits, and that has to be done first, because not that we don't trust everybody, but people may go through grant or SBA loan application first and get funds, and then go on the back end and apply for insurance, knowing that they're eligible and get that funding. If the last thing that we want to do is go into any kind of recoupment process, right? We don't want to recoup funds. So if things are done in their order, then that avoids that possible scenario. Let's see, what else? Application process, right? So this is for the grant, the public assistance, right? So the area firstly must have had received a federal disaster declaration, right? And you want to coordinate with your local or state emergency managers to find out what the schedules are for the applicant briefings, right? So they have these town halls, or they have these public assistance meetings to explain the process for applying for public assistance. So get with your local or state emergency managers, see when those schedules, briefings are, and attend them. Get the information that you need from the subject matter experts that are there on hand. And note that this is time sensitive, right? So you have to submit a request for public assistance through the grants portal within 30 days of the date of a presidential disaster declaration. So you can't, while you're applying for your insurance, while you're applying for everything else, you could do that. You could also apply for this, but because this is time sensitive, so you don't have to wait till you get that deck page. Once you get that declaration page from the insurance, then you submit it to FEMA, and the due diligence in the process goes through. But just know that this is a time sensitive, so be cognizant of that. And then what you'll need to provide, there's a list here. Evidence of federal or state tax exempt status or other documents indicating nonprofit status, such as your bylaws or articles of incorporation, pre-disaster evidence of incorporation, charter, or your bylaws, a data universal number systems number established with the government. What that is, you may know it as a DUNS number. And then you would register through the SAM portal. So that's a system of, I just forgot what SAM stands for, but it's another system, right? And that's something that businesses would need, right? So to get this grant funding, you would need that DUNS number, and you can get that by going through grants.gov, or just Google, how do I get a DUNS number, or data universal number systems number, and you'll have some resources there on how to get that DUNS number and register through the SAM portal. Again, and the funding that is provided to you is done through that. So a DUNS number is basically like a business equivalent of a social security number. And then the other thing that you would need, and that's stuff that you want to do beforehand, right? So you don't want to wait till event. It does, just go ahead and do the research now, get your DUNS number, have that ready, good to go. Supporting documentation establishing lease or ownership of the building, or proof of use, and proof of insurance. Again, that's that insurance claim that we'd be asking for, and all the other the proof of use, so how you use your facilities to determine whether it's critical and non-critical. If eligibility is granted, the following will need to be submitted: a list of sites damaged, before and after pictures, and information about any historic structures, right? Because those are protected under the Environmental Protection Agency. So if you haven't done it yet, when you're done with this, go to your house of worship and just start snapping pictures and take inventory of your goods. Okay, and last but not least, this is almost, this should have been at the very beginning, but I put it at the end for the sake of time. But it's important for you, depending on the, how big your house of worship is or the services that you provide. So we in government like to, we need a COOP plan, a continuity of operations plan, or COOP, right? Because if FEMA headquarters in Washington, D.C., which is where I work, should it go boom and that facility is gone, all the services in there are gone, all the key leaders and personnel are gone, what is a continuity of operations? What would happen to those services or that information? So you may not necessarily go through, this is a table of contents basically from a training that we provide. So it may or may not be applicable to you, but what you would, these are the elements that you would include in a continuity of operations. So just food for thought, things to think about, and see if this is something that you would need to do for your establishment. Should your establishment become inoperable and leaders are no longer there or unavailable, what is your continuity of operations? So what are the essential services that you provide, the essential functions? Do they need to be provided elsewhere? So continuity of operations plan would include, delegation of authority. If key leaders are out of the picture, who is next in the succession, right? What are the authorities that they have? And this needs to be transparent and shared amongst all the parties so that they know that they have a responsibility. So this is coordinated. What are the alternate facilities? If you are providing some of those key essential functions, do you have alternate facilities identified? Maybe a sister congregation or house of worship that's outside of the impacted area. You could designate a couple or whatever it is. Again, things to think about. Interoperable communications. So what does your communication system look like? Do you have satellite radios? Should cell towers be down? Again, we're in an era, a season where communication is a lot easier, but it's also a little bit more dangerous because we rely so heavily on it. And should there be a glitch in the matrix, a system failure, right? If we get cyber attacked and our emails and our cell towers and everything is compromised, how do we communicate? Carrier pigeon, sat radios, just think about those things of communication, because we are, as connected as we are technologically, we are also very vulnerable. Again, vital records and databases. So where do you store your records, like your membership base, your leaders, your tax documents? Where are your vital records kept in your databases? Do you have backups for that? Is it on an external hard drive? Is everything on your desktop? Like me, you don't even want to see my desktop. It's got full of icons and I think, oh, I have to back this up. I have to back this up. I'm actually going to do that right after this. But you have to think about these things, about your data. So your human capital, so your personnel, you're thinking about, if you've got paid staff, you've got to take care of your people. So what does that continuity look like? Once you've developed a plan, that's what this next bullet is. You want to test it, you want to train on it, and you want to exercise your program. So have a drill. So if you choose to do a continuity of operations plan, make sure that you exercise that plan and make sure that you work out any kinks beforehand. And then the last thing is something that we do in government, right? Where we go somewhere else, and reconstitution. Should, hopefully, everybody didn't go away and it was just a matter of a period of being unavailable. So once the area, the prime location is back and ready to be operable, what does that reconstitution look like? So what is a transfer of authority and power and planning and documents? How is that brought back to the home station? So again, just things to think about. If it's something applicable for your house of worship, I highly encourage you to at least take some of these elements and put it down on a piece of paper and communicate with your leadership, your congregation. Let them know that this exists. Be transparent with what you're doing, because your members have an expectation of this facility being there, and should it not be there, what are their resources? What are the where do they go? Who do they contact? So you want to make sure that this is transparent. And lastly, just a list of resources. This is not all inclusive. These are just some of the key ones. So some of the information that I shared was thanks to my colleagues up at the DHS Center for Faith-Based and Neighborhood Partnerships. So I did coordinate with them in obtaining some of this information to share with you all. But that is their, if you want to sign up for their distribution list, please do so. That's the email to send to, and their website. Our email is the next bullet there, voluntary agency coordination. That third one, the voluntary organization information system for engagement, that's a dashboard, the Connect Solutions, that we put together that has information. We update it daily. It's got some resources on it. Just go ahead and click on it and see what's on there that you could download. If you have any questions, our Val map, which is on the next slide, is on there. So feel free to browse. The same thing for our national donations team, that the group of subject matter experts. So you can go visit their webpage as well. And then the last bullet there is the National VOAD link, so that you are familiar with the organizations and who to contact. And there are also, I shared with Mary, and she will upload it onto the webpage, a list of other resources. There are other Homeland Security components that have faith-based office, just like the Department of Homeland Security. So even though DHS Center, they are housed with FEMA, but there are other Health and Human Services, other entities that have faith-based offices, and they've got, how to protect yourself from active shooters, which is not something that I talked about here, but you definitely want to protect yourself and know what to do in an event of an active shooter or some other types of man-made events or terror attacks. So look at that list of resources, click through them, get that information, put some plans into place, and protect yourselves and the people that you serve, because we all need you. And you are vital to emergency response, to preparedness, to recovery. You're vital to your communities. You're definitely vital to emergency management. So please take a look at some of those resources. And lastly, this is my counterparts. If you look all the way to the right, I'm like the headquarters DC. That's my email there, Miriam Gelo. But these are the FEMA regional breakouts, who the FEMA regions are. Again, you can go to your state websites and find out who the state VAL is, or contact the FEMA region if you have any questions on to who's who. And they will definitely connect you with the people that you need to be connected with. But that, Mary, concludes my brief. If there are any questions, please feel free to reach out to me at that VAL team, inbox val-team at fema.dhs.gov email, or my direct email is there on the slide. You have resources. Know that you are not alone in response and recovery. There are people willing to help, and we encourage you to get engaged and connect and coordinate and collaborate and just be part of the response with us. And it would make it a lot, the response and recovery a lot smoother. So with that, thank you so much for your time. And I'm here should you have any questions. Thank you. Thanks,
Miriam.
Mary.
Miriam, thank you so much. You said how you need us, but I just want to tell all of our viewers how much we appreciate and need our VALs, our voluntary agency liaisons. They are truly heroes in the faith-based community, in the voluntary organizations active in disaster, the VOAD community. They help us untangle and understand a lot of the complexities. These sessions are called the leader briefs, and Miriam has done an amazing job of putting a very distilled, concise summary of just the beginnings of all of the knowledge that she has for us. Miriam, I want a couple of questions that our viewers might be interested in. First of all, I do appreciate how you talked about the difference between response and recovery, and you had that defined on the slides, but I wonder if you could say just another clarifying word, because we toss those words around a lot. And many of our faith-based organizations who are not perhaps experienced in disaster are just thinking about response. So I appreciate your focus on long-term recovery. Those two are words. Would you maybe define a little bit of difference between those two words?
Sure, absolutely. Yeah, so response is exactly that. It's, boom happens, or there's preparation for response. It's those immediate services that we all as a whole community, and that's from that local level or that individual and household, because that's really where it starts, all the way up to the federal government. It is helping provide those life-saving, life-sustaining services, right? Because that is the focus in response. We want to make sure that people are safe, that people are evacuated, that any life, you know, life compromising situation is addressed, whether it be those sheltering services, getting a roof over your head, the feeding services, can't have people going hungry. So what are those life-saving, life-sustaining needs? Urban search and rescue, depending if it's a tornado, catastrophic event, earthquake. So that's immediate response. If you're looking at a timeline, you can't really put I can't say it's the first 60 days. I can't say it's the first 30 days. I can't say it's the first 3 months of an event, because every disaster is unique. For example, in Puerto Rico, after Hurricane Maria, they had power out for almost a year, right? And so response was ongoing for just about that long. Meanwhile, recovery efforts are beginning throughout that time. So it's not that response was really a year long, but it was more than those 30, 60, 90 days that we're thinking about. So there is no clear definition on response, but just know that it's those life-saving, life-sustaining services that are being provided. Commodities are coming in, roofs are being tarped, just for people to be in safe, sanitary, and functional dwellings, if you will, if they're sheltering in place. Recovery is you're looking at the long term. So there's short-term recovery, there's that long-term recovery. So some of these phases overlap, but when we're talking about recovery, it's things have stabilized a bit. You're going from that immediate casework, and there is a difference between casework and case management. So casework, again, is providing those maybe initial programmatic assistance, but it's not getting that survivor to their new normal or providing them with everything that they need for their recovery. So you heard me mention about case management before, and case management is that they are assigned a case manager. That case manager is working with them from soup to nuts, getting all the information, getting the assistance done, all the FEMA assistance, the Small Business Administration loan, funding, their insurance funding, any assistance that they've received from any other source, maybe getting volunteer help to use some of those funds that they received, and getting volunteer help to do construction on their homes. So the case managers help working with the survivors to get uh, resources, right? So what are those unmet needs? But it's like looking longer term. It's the community is stabilized a bit, but recovery also encompasses um, local infrastructure. Is that coming back online? Or it should be coming back online, and things are starting to operate now. Recovery can last for years. It could last for decades. As did like Northridge earthquake. I'm going way back into the early 90s. But Katrina, more recent-ish disaster in 2005. You've got Hurricane Maria, again, catastrophic. The island is still recovering. And that was 5 years ago. Yeah, 4 or 5 years ago. So again, that's the difference between response and recovery. You've got those immediate life-saving, life-sustaining services, and you've got a bunch of resources that come in, whereas resources start tapering off, those federal and uh, other resources start tapering off a bit as recovery goes, and the community and the locals start taking over and helping their communities get back to their new normal. I hope that answers that, Mary.
That's a wonderful description, Miriam. And, I think both you and I share a bias in that the faith-based communities are truly the backbone and the heart of that long-term recovery. They're there long before the disaster occurs, and they're there long after as well. So I appreciate you describing that process just a little bit more. Also want to mention, I'm going to guess that the vast majority of our viewers are connected to a faith-based organization that is a member of National VOED. And I think the percentage is pretty high of the members of National VOED, certainly the state VOEDs, that are actually members of the voluntary organizations active in disaster. And I'll mention our sponsor today, Church World Service, is also a member of National VOED and in many states as well. So Miriam, again, I thank you so much for your time. You are such a wealth of knowledge. Trust me, viewers, when I tell you Miriam is one of the very, very favorites of all of our vows. So if I'm saying that the vows are favorites of the faith-based communities and Miriam's one of the favorites of the vows, that says a lot. So we appreciate so much. Okay. Any questions that you have might be answered as you are seeing the resources that will be at crisiscareministries.net, clicking on the webinar hub there, and we'll post a lot of the things that Miriam has mentioned today as well as her contact information. So remember to go to the webinar hub for resources and other information, and watch your inboxes for recordings and a link to the session, evaluations, and resources. It was such a pleasure to be with you here today, Miriam. If we were all here and on a Zoom, you would be seeing a lot of this. So just imagine a lot of people saying thank you to you.
Just to you all, yeah.
Look forward to seeing you in person again soon. All right.
Likewise, and thank you.
All right, thank you.
Thank you.